ADHD is a real medical condition that affects millions of people around the world. It is neurodevelopmental disorder that usually first diagnosed in childhood and often lasts into adulthood. It is widely recognized by the medical community. Despite this, there are still some people who doubt the existence of ADHD. Here, I will explore the reality of ADHD and address some of the common misconceptions about this condition. It is important to understand that ADHD is a real disorder with a biological basis. People with ADHD have differences in brain structure and function compared to those without. These differences can be seen on brain scan and are thought to contribute to the symptoms of ADHD, such as inattention, hyperactivity, and impulsivity. ADHD is also known to have genetic component. This condition tends to run in families, and there are specific genes that associate with an increased risk of developing the condition. ADHD is not simply a result of poor parenting or a lack of discipline, but rather a complex interplay between genetic and environmental factors. Another common misconception about ADHD is that it is overdiagnosed. While it is true that the rates of ADHD diagnosis have increased in recent years, this is likely due to the greater awareness of the condition and improved diagnostic tools. ADHD is also misconceived as childhood disorder that disappears into adulthood. While it is true that many people with ADHD are diagnosed during childhood, the condition can also persist as they grow up. This can lead to significant impairments in daily life, including difficulties with work, relationships, and self-esteem. Some think that ADHD is simply an excuse for bad behavior or poor academic performance. This is simply not true. People with ADHD often struggle with executive functioning skills such as planning, organization, and time management, which make it difficult to succeed in schools or work. They may also struggle with emotional regulation, which can lead to impulsive or inappropriate behavior. I never diagnosed with ADHD, but it took me years to realize this medical condition. My brain constantly prints out ideas and I cannot stay consistently. It is tiring since every now and then I had constant flows of idea or action. It often disrupts my own choices, task execution, sleep, and possibly anything I had to do in my daily life. So, do you think ADHD is a real? While there are still misconceptions, it is important to understand that ADHD is a complex disorder that can have a significant impact on daily life. By increasing awareness and understanding of ADHD, we can help to reduce stigma and improve the life of those affected by this condition.